A very good afternoon to all. Thank you for coming. My name is Mazia. I'm going to be your first aid instructor for today, and we are going to talk about chest pain. So, regardless of whether a patient is 45 or 85 years old, when they presented with the signs and symptoms of chest pain, it should always be treated as an emergency. Now, maybe the cause of the chest pain is nothing more than just abdominal pain or muscle strain, or even some other common areas other than the chest. However, often the pain can point to a more serious and potentially life-threatening cause, such as an acute myocardial infarction or AMI for short. Now, for this reason, chest pain must always be considered cardiac in nature until proven otherwise. Now, making an accurate chest pain, perhaps the most important skill any rescuer like yourself can bring to any situation, is the ability to perform a cardiac assessment. Now, this is particularly the case when the patient is experiencing chest pain, and it will help to determine whether the pain is cardiac in nature. Just as important is the ability of the rescuer or yourself to do this in a calm and composed manner. Now, these are the type of questions that will guide you to do the assessment. It's called LIQUORD, liquid. L stands for location, I stands for intensity, Q stands for quality, U upsetting or aggravating factors, O stands for onset, R relieving factors, and D for duration. So this is a guide, and the following assessment should follows and applies. So where is the pain? Can the patient point to you where is the exact location of the pain? Is it on the chest, or is it on the back, or is it on the abdomen? What makes the pain worse or even better? Is it worse upon standing or better upon sitting? And what were you doing as the pain started? Were you doing a physical activity, or you were just watching TV? Does the pain change with repositioning? Does it change when you're sitting, or it changes when you're lying? Now, does the pain radiate to other parts of the body? Whether it radiates to the neck, whether it radiates to the jaw, or whether it radiates to the arm, or whether it radiates to any part of the body. Is it a dull ache pain, or is it sharp radiating or crushing pain? Now, can the patient rate the pain scoring 0 to 10, 10 being the most painful? Now, can the patient relate to the pain scoring? And will there be any other symptoms? And how long have the pain been there? Is it the pain is just an intermittent on and off kind of thing, or is it a continuous ongoing pain? Now, history does matters. When you assess the location, you are actually establishing whether it is more in the central chest, or is it more to the right side of the body, or perhaps on the left side of the body. So the location helps to guide you whether it is a chest pain, cardiac in nature. And whether the patient presented with short of breath, sweating, nausea, or maybe vomiting. Whether it's a gradual onset, or is a sudden onset. Whether the pain what makes the pain worse or better. And in terms of radiation, whether the pain is radiating to the back of the body, or whether it's radiating to the neck or jaw, or even the arms. And the severity is to establish how painful is the scoring. Now, the basic treatment for cardiac-related chest pain is number 1, oxygen therapy. Now, your heart is made up of muscle, and it requires a blood supply to function fully. And therefore, it is important to ensure that enough oxygen is being rendered to the victim. Number 2, coronary vasodilators can be administered in the form of a patch or even a sublingual manner. And this actually helps to produce a vasodilator effect, which means it improves the coronary function and the oxygen supply to the heart. And the next treatment is what we call is antiplatelet or aspirin. And if you know, aspirin can be prescribed. If not contraindicated, in the setting of chest pain to reduce the risk of clot formation in the blood vessels. And of course, we must ensure that the patient is relaxed and reassure the patient to reduce anxiety. And of course, you need to relieve the pain if there is a pain scoring where a prescription of morphine may be prescribed. And I think it is important for you to continue to monitor the vital signs to ensure that patient's blood pressure, heart rate, respiration rate is monitored closely. And of course, it is always important that all chest pain is quite a common complaint. Always try to rule out that it is life-threatening causes of the chest pain. Now, in the process, if you find difficulty and challenging to manage the victim, always seek your senior's help to obtain some reassurance from your colleague. With that, any questions from anyone? If none, thank you so much for your attentiveness.